You know, Coastal Family Health Center has been serving the Mississippi Gulf Coast for 35 years now. Well, today we're talking to the Director of Development, Kathy Dumal, and thank you very much.
Thank you.
This has been quite a program.
It has.
It really has. Tell us how this got started.
Well, community health centers nationwide have been around since 1965, and they were started to help with those that were struggling, like with a low income and can't afford insurance and that sort of thing. And actually, we generate $24 billion nationwide every
Wow.
year to help with savings for, medical care. So we have like 9,000 nationally. Now Coastal is 35 years old, and we're here to serve everyone. But what makes us different is that we are situated in areas where the low income usually live, and so that we can meet the needs of that community.
Make it more convenient for them.
And we have like 29,677 patients last year.
Wow.
50% are uninsured. So we do work a lot with the uninsured, underinsured, those that have lost jobs that can't afford their health care insurance or whatever. So we're here to serve everyone, but we do work a lot with those that are uninsured.
Now, and with those, as far as payment, what kind of scale do you work with?
Well, we're also different in that I think we're about the only one that do fee-for-service. So it's scaled to your income according to the National Poverty Guidelines, and that's based on number in the household and income. So when you come, we ask for proof of income. You'll need an ID, photograph, and we work with you on that. So.
That's amazing. That's amazing. And I was looking at all the different locations here in 6 coastal counties.
Yeah.
Bay St. Louis, Biloxi, D'Iberville, Gulfport, Moss Point, Pasquo-Shan, Socia, Van Cleve. You have a mobile unit.
We have 2 mobile units.
2 mobile units.
Yes.
And school clinics as well.
Yes. We actually have a catchment area of 6 counties, but we have our clinics in the 3 coastal counties. And as you said, we go from east to west, with 10 clinics, 2 mobile units. One is a mom and baby unit, help supported by the March of Dimes. The other is with the Children's Health Fund, and it works with children. And then we have 2 school clinics, 2 in Moss Point, 1 in the high school and 1 in the junior high school.
And and looking at the brochure, that all the information in here is amazing. It's just amazing as far as the different services you provide, including a pharmacy.
Right. We have our own pharmacy. Now you have to be a patient of ours to use our pharmacy, and we're very competitive. And we also have what we call 340B pharmacy, and that allows us to purchase medications at a lower income, and so. We can offer that to our patients.
Pass the savings on to them.
That's right.
And as far as there are several of the health, the hospitals that you have partnered with
We
as well.
partner with all the hospitals here on the coast. We surely do. We have a lot of partners in the community, other nonprofits. We work with just about everyone.
And the different doctors, you have doctors here, nurse practitioners.
We do. We have our physicians, we have MDs, DOs, nurse practitioners, physician assistants, and we have nurses, MAs, we have RNs, LPNs. We work with everyone.
Okay, let me ask you this. How do you run into the problem of language barrier?
We have translators. We have a Vietnamese translator and Hispanic translator.
So that's a growing part of our community.
Well, it is. And additionally, we have a phone service that if you're in a clinic where there's not a translator that day, then you can use the phone service and we can have any language translated.
Wow. That's, I don't know that any just regular doctor's office can do that.
No, we're kind of unique in that,
Definitely. And again, there's so many different groups, I would say, are people from different countries that, they make their home here on the Gulf Coast now.
They do.
So, and you hear all kind of different languages. And, even when I came in here today, I heard someone, speaking in Vietnamese.
Yes.
And one of the employees here, one of the workers, are just speaking right back to her.
That's
I thought,
right.
that is really cool.
That's right. And, we offer a lot of services to everybody. Some of the services we have are like we primary health care, of course, but we have dental. Our dental clinics are in Gulfport and in Biloxi. We have optometry, which is here.
Wow.
And yes, in Biloxi. We also have women's health, and that is in Gulfport Clinic, Gulfport 2 actually, and also on the mobile unit. And as I said, we do prenatal care. We also have pediatricians in every clinic. So we provide the whole spectrum of healthcare.
Even transportation assistance.
Some.
on
That's
that.
limited, yes.
And again, reading the optometry,
Right.
Get your eyes checked. I know one of the programs you have here is the WIC program.
Yes.
That's very big.
We're not a distribution, but we work with WIC patients, yes.
Okay, okay. And counseling?
We do. We have behavioral health, and we were the third community health center in America to have mental health integration. And that is where we work together with the provider at the bedside of the patient initially, do depression screening and that sort of thing. So.
And you know, being down here where we are, and like we would say, we're right in the middle of Hurricane Alley. You know, right after storms like that, I'm sure that you deal a lot with patients, especially those going through forms of depression, or whatever, you know, maybe lost some partial property or whatever.
Right, right. We have psychiatric nurse practitioners, and we do work with patients a lot in behavioral health.
Now, as far as you know, internal medicine, you cover the whole gamut of that?
We do. We do not do specialty care like you may be referred out if you need something like if you have cancer, you need an oncologist or something like that. But as far as primary health care, we cover it all.
Okay, and vaccinations?
We do. We have vaccines for children and any adult vaccinations. You can.
Flu shots?
Flu shots. We definitely have flu shots, and we encourage you to come get your flu shots. Yes.
Everybody needs to come get your flu shot.
Yeah.
Well, you know, it's amazing too, and the great services that y'all have, and I love, you know, your mission statement here in your brochure to promote healthy communities by providing accessible, quality primary health care services to all persons regardless of economic status. We accomplish this with competent and caring staff who work to meet and exceed expected standards for care and customer satisfaction. And you see that walking through here.
Right.
You see so many, you know, smiling faces of people that work here.
Well, we do. We're happy.
You're happy?
We're happy we can serve.
And
yes, and we cover the whole lifestyles. I mean, the whole lifespan. So, you know, we welcome patients. We're glad to have anyone that wants to come see us.
All right. Well, thank you so much.
Thank you.
Kathy Dumal, who was Director of Development with Coastal Family Health. If you'd like some more information, of course, what you can do is, you know, give them a call. I'm sure, or you can stop by, pick up a brochure at any of their locations, call the number on your screen, and you know, find out more information about that and exactly where the closest office is to you.